Most nuclear reactors concern themselves with two different forms of regular elements, uranium-235 and plutonium-239. But from the 1950s to the 1970s, the United States was researching a third of these isotopes, uranium-233. It was a promising synthetic, heralded as the third potential source of nuclear power and weapons. But it had problems. Chief among them was the fact that it was much more radioactive than an equal amount of uranium-235 fuel. That made it extremely hard to handle, let alone work with and keep secure. The United States ultimately decided to abandon this isotope, and the nation's stockpile has sat, still hot and hard to handle, at Oak Ridge National Laboratory for decades. All of it was in the process of being finally disposed of, until a private company decided that this failed nuclear fuel could be turned into nuclear medicine. And not just any medicine, a cancer treatment that seems almost too good to be true. Enter TerraPower, a self-proclaimed nuclear innovation company. Founded by Bill Gates in 2006 and partially funded by the Department of Energy and Los Alamos National Laboratory, TerraPower is one of the few private nuclear development and design companies that is making real progress on both of those fronts. I was invited to tour TerraPower in the February of 2025. In part 1 of this sponsored series, you will see the science behind turning unusable nuclear fuel into cancer medication. In part 2, we'll explore and explain what will be, if everything goes according to plan, the first next-generation nuclear reactor to operate commercially in the United States. But first, the inner workings of TerraPower Isotopes, where dozens of visibly excited scientists and engineers are working with a failed fission fuel to give doctors a new tool. An isotope so rare that the world's total supply could fit in the palm of your hand. Actinium-225.
So TerraPower Isotopes is in the business of producing and distributing actinium-225 to the world in many different locations. We are the first line in a chain of events that ultimately culminates into the use of our product into a cancer patient for treatment in what is called targeted alpha therapy.
Though alpha radiation, or helium nuclei that fly out of decaying atoms, has been recognized as a potential cancer treatment since Ernest Rutherford discovered alpha particles over 100 years ago, it's never really been used. The reason being that, unlike X-rays or proton beams, alpha radiation is stopped by almost anything. But thanks to new pharmaceutical developments and an isotope of actinium that both comes from thorium and shoots out alpha radiation, that's the best part about it.
And alpha particles are particularly a promising agent because they emit high energy over a short distance, which makes them a very good aspect for targeting a cancer cell specifically. So they would get targeted to that malignant tissue. They would destroy that tissue with minimal damage to surrounding tissue. So that has a lot of promising implications in the radiopharmaceutical world.
What has only recently happened in the pharmaceutical world is the development of molecules that can both target cancer cells and only cancer cells, and more importantly, they can attach themselves to actinium-225. This achievement unlocks the potential of alpha radiation. Instead of having to perfectly aim a proton beam at a tumor in three-dimensional space or take drugs that dose the entire body with huge side effects, TerraPower is supplying an isotope that damages only the tissues it touches to companies with drugs that only target tumors. The results speak for themselves, and they speak pretty loudly. The medical study image on the left is a patient unfortunately riddled with metastatic prostate cancer, but the image on the right is of the same patient after actinium-225 treatment. You almost wouldn't believe it if it weren't in a medical journal.
That's just a couple of months.
Yes.
That's not even a full year.
Exactly.
TerraPower now has over 100 employees working at TerraPower Isotopes because the apparent benefits of actinium treatment just keep coming. Normally, treatment with radiopharmaceuticals can have life-altering side effects. For example, you can't be in the same room as your spouse undergoing treatment because the ambient dose rate from them would be too high. Actinium-225 doesn't have that problem.
because of the low penetration of alpha particles, your body actually serves as the shielding for that. And so because the body is able to shield itself, patients are able to receive this treatment with their family standing next to them.
Right.
They're able to come into the hospital, receive their treatment, and leave without having to stay alone overnight. And then most notably is because that alpha treatment is targeting the cancer directly with minimal damage to surrounding tissues, the patients, they go home and they feel okay.
If you can target cancer cells directly with actinium and leave other rapidly dividing cells alone, like those in your scalp and in your stomach, you don't lose your hair. You don't get nauseous. Actinium is potentially a boon for oncologists too. You don't have to make an extremely short-lived isotope on site with expensive equipment. It can be shipped to you by TerraPower isotopes anywhere in the world while it's still useful.
Actinium-225 has a half-life of 10 days, which is optimal because that gives you enough time to produce this isotope, send it out, get it to the pharmaceutical manufacturing company, have them bond that to their targeting molecule, and then get that to the hospital. So a lot of times when you look at short-lived radioisotopes, you have to produce it in the hospital and immediately inject it into the patient. And that creates some instability in your ability to consistently get that isotope to the patient for treatment, because these treatments have to be done with a certain amount of periodicity for them to be effective. Actinium-25 really fits that bill, and we call that our golden egg because it really has all of the elements of what we are looking for in an effective isotope.
Like you'd imagine a golden egg to be, Actinium-225 and the elements that produce it are extremely rare. The current amount of thorium available to make actinium in the whole world weighs less than 2 paperclips.
When you were speaking to those folks at Copenhagen Atomics, right? Part of that, their great idea is you take the thorium-232, you breed it, and this is what they're trying to make. And that's exactly what we did in the Cold War in the United States. And so the national labs looked at that and said, well, we can't use this as fuel, even though we know it's good fissionable material. It's really good. It comes out enriched already. There's no more additional enrichment associated with it, but it's too hot to handle to create fuel. Parked it away, 450 pounds worth of material across the national labs of the United States, something like that. And then at some point 20 years ago, as this decays down to thorium-229, we pulled a little bit out of the stockpile just to test it. Starts creating the actinium-225 that the research development companies have. And so there's about 1.6 grams of this material worldwide.
Less than 2 grams of thorium-229, which decays naturally into actinium-225 that cancer researchers want, is the entire world's supply. Right now, the only way to get more of it is to turn nuclear trash, unusable uranium-233 from the Cold War, into nuclear treasure.
And so the disposal process started occurring about 2005. So the Department of Energy hired a company called Shattuck in Oak Ridge, Tennessee. Scott referred to that earlier.
Yeah.
And their job is to take this material, dilute it down, put it in the desert, effectively. And so it just happened to be a confluence of time. Studies like the one we just showed you came out that said, hey, this actinium is really, really, really working well in the pharmaceutical world. What can we do?
Yeah.
That's kind of where TerraPower came in, because we understood this part. We know people at the national labs, and so we asked if we can have the thorium-229 in a kind of way. Very shortened version. There's a lot more behind the scenes, but in the end, TerraPower got title to by investing in Shattuck, this material. And so it's coming to us now. As you can see, as we downblend this material, all that's left will be this. And that's all the whole world source is going to be this, is what we get here, effectively.
Really?
And so we have to be very, very careful. Our number one rule is don't lose the thorium. Because if we lose this, then there is no more actinium, effectively, until other processes perhaps come along.
So if there's only a few paperclips worth of precious thorium to work with, you'd expect that once TerraPower gets a hold of all the available materials sitting in stockpiles, they'll have a lot more of it, right? Nope. But that's another benefit of this cancer drug. You don't need a lot more of it.
And so the amount of thorium that we're going to receive at the end of this is going to be somewhere between 40 and 45 grams. And to give you a visual of what that looks like, 16 washers. This is all the thorium that we are going to be able to receive. And this will help provide millions of doses of actinium for treatment. It's enough to treat patients at least through our lifetime.
You know, the government, Department of Energy, is doing a good job with the cleanup. They're working with a company called Isotech. They're going to turn all of that waste into grout, basically. We're going to solidify it so that it can be buried very safely and disposed of forever. And what our radiochemist said was, that would be like this huge shame, right?
Bring that to us.
In those tons of waste, there's like 50 grams of thorium-229, because again, it started as uranium-233, you know, over a ton of waste. And then because uranium has, you know, very long half-life, 50 years later, 60 years later, we've produced like 50 grams of this stuff, which is a needle in a haystack. And I think the best way to think of it, and you have to geek out a little bit to talk about it this way, is you know, in high school chemistry, right, we all learned about Avogadro's number, right?
6.02 times 10 to the 23rd?
You got it, Kyle, right? and so that 50 grams of thorium, which we have now, which is like it's about a fifth of a mole. So it's on the order of 10 to the 23rd atoms we have.
Yeah.
And so I remember Avogadro's number, but one thing I didn't know until recently, which was how many cells are in the human body.
It's got to be less than a trillion, hundreds of billions, maybe a few trillion.
You're in the right neighborhood. So it's on the order of 10 to the 12th cells in the body.
So, yeah, the 10 trillion.
Yeah.
So you're talking about for every cell in the human body, you have maybe a trillion atoms, or, you know, 100 billion atoms of actinium, which gives you a sense of, if you can make it hyper-specific and attacking specific cells, then you have all the atoms that you need.
You've got it.
Remember that the big breakthrough here that got doctors excited about alpha therapy again was the drugs that could make it so targeted, down to individual cancer cells. There are around 10 trillion cells in the human body. TerraPower might only have a few grams of actinium at the end of their program, but thanks to Avogadro's number, 45 grams, less than the weight of the phone most of you are watching this on, is still enough to deliver, mathematically speaking, at least one atom of actinium to every cell of every person on the planet. Of course, the treatment is only going to cancer patients, and only a small fraction of those cancer patient cells are tumor cells, but you can see how TerraPower might actually help treat hundreds of thousands, if not millions of people for years with only a tiny amount of this isotope. But first, they actually have to get the isotope. And that's not easy.
Is what you're doing difficult right now?
Yes, it is. At least for me, because I just started. This is training right now for me. It's just a lot of like little things that you really have to know, and like little techniques that I'm not great at yet.
So you might be asking yourself, you're manipulating extremely hot material and you want to get up close and personal with it. Not only that, you want to eventually have it in people's bodies. How do you manipulate it safely in a way that's in accordance with all the regulations, everything you want to be doing in a place like this? Well, you put it in something called a hot cell. That hot cell contains hot material. Engineers are very creative. But how do you manipulate that material? You do it in a mechanical way with arms like these, which effectively extend my body into that hot cell. And I've never done this before, so let's see how hard that is. way harder than it looks. I have a newfound appreciation for what you were training on. Of course. Yeah, that's hard. It's like...
Yeah, you might feel it tomorrow.
Yeah. It's like your first time rock climbing. Like, oh, I didn't know I had all those tiny muscles in my hands. That's great.
TerraPower Isotopes is going to obtain decades-old nuclear fuel. They're going to manipulate it with fancy robo-arms that I'm super good at, hire me, in shielded boxes, but how are they going to painstakingly harvest the ultra-rare actinium as it forms from half-life? Well, that's what I was going to learn about next. So I suited up and made my way into the labs where the golden goose was laying those golden eggs.
I would say we have to be better than what we consider a pharmaceutical grade. Our water's cleaner, our vessels have tighter specifications for trace metals very specifically.
This is my new favorite person, Laura Lilly. They explained to me that because TPI only has access to a handful of actinium atoms at any one time, their production is all about precision. Like crazy amounts of precision.
So, in principle, we need to have as few things with the actinium as possible. So that includes the trace metals that come out of glass. So borosilicate glass, zinc, sodium, potassium, boron, lead, right? So we do all of these processes where we're like acid leaching our glassware to remove as much of these trace metals as we can before we even start. So 99% of the magic happens before we even go into the hot cell. This is water with nothing in it.
So it's pure H2O?
It's pure H2O. If you took the pH of it, the answer would be no thank you.
So if you're dealing in ppm or ppb or anything like that,
we're in the PPT range.
Oh, wow.
Parts per trillion. Yeah. Our specs are about as low as you can reasonably measure without taking extraordinary steps.
What's extraordinary about TPI is that they have already started making and delivering actinium-225, and all out of one room with one hot cell.
Alexia over here is on the manipulators real time, doing manipulations associated with actinium production.
She's way faster than I am at that.
How long did it take you to get really good at manipulating stuff like this?
Oh, I'm still in training. I'm still a little slow, but I would say it takes probably a couple months of getting comfortable.
Do you have new weird hand strength?
Oh, absolutely. My grip strength is much better than it used to be.
So that little paper viewing window you were looking through earlier,
yes.
you are now looking through lead glass.
Right.
All right.
It's the yellowish tint.
After Alexia was done making me look like a total noob with the manipulators, thanks Alexia, Laura got to the good stuff. Their Ghostbusters-like way of getting radioactive material refined enough to ship all over the world.
So we use these beta canisters, and each hot cell has an alpha port that is behind a shield door.
So it is Ghostbusters eating.
It is Ghostbusters eating. So we can go in from like a pre-chamber of a glove box, which is basically opens to the room, take our stuff into the glove box, put it into one of these canisters, and then walk the canister over to the hot cell, bank it, yeah, and then bring all of our stuff in.
And believe it or not, working on a drug that kills cancer cells with radiation isn't actually that much of a radiation hazard. That is, if you do it right.
Dose isn't scary.
Yeah.
You know, you get more dose flying on an airplane every single time than like we do probably in a month, frankly. The hot cell does your first big crude separation of the actinium from the thorium. It has radium, it has all of its daughters. Then we do a volume reduction separation, and then we do a fine separation, which is happening right now, which basically gets us to the point where thorium's no longer detectable, radium's no longer detectable. We basically have actinium in a vial that we then transfer over to a glove box, and we run our final separation, which I said we did a fine separation where we do another fine separation.
So how do you get from what you're doing in there to end product in here?
Purifications, bulk purifications, down to a single 20 ml vial that comes over for our final purification that exits in about another 20 ml vial. We've done our QC checks. We know that it's radiochemically pure. We know it's radionuclidically pure. So we have the right isotope. It's in the right place. It's in the right concentration. And then we can load this up with product vials for our customers. And it basically will automatically transfer from our bulk actinium vial into our product vials that we then can actually swipe. Coming out through that chamber on that side. We swipe them to be under free release criteria in their pigs, and then they get packaged up and shipped out.
So this whole operation to potentially treat hundreds of thousands of people comes down to this box.
Yep.
And things like this big.
Yep.
Dang.
Right. We are running full speed with weekly production in the equipment you can see in this room.
We're shipping actinium to companies that are in clinical trials for multiple different cancer treatments.
Incredible.
Yeah. When our team is doing their work, they know that everything they're doing, within 2 weeks, in the short period of 2 weeks, that actinium product is going to be shipped out the door to drug companies all over the world who are doing trials. That actinium will be radio labeled, they call it, or attached to a cancer finding molecule.
Yeah.
And it will be in a person in human trials, which by nature of these clinical trials, they're the most severely ill people who are benefiting from that. And we have really, we're quite optimistic that some of these drugs are going to be successful. And
that's incredible.
Yeah.
I saw the labs. I got offered a job as a hot cell operator hire me, and I even got to place my own radiocode inside some pretty hot storage shelves. But TPI wasn't done with me yet. In what was a first for me, it turns out that I had been contaminated, likely by naturally occurring radon gas picked up by TPI-sensitive portals, and was forced to create my own nuclear waste.
You actually have a little crap on you.
I got a radioactive ass?
A little bit.
Dang. I mean, I knew it was hot, but...
Yes, dear reader, when I departed TerraPower, there was a bag of low-level radioactive material with my name on it. The coat would eventually decay out and be usable again, but dang, what an honor.
What's really exciting to me about TerraPower is that it's not just a new nuclear reactor company. It's also in the business of turning what was once pure nuclear waste into life-saving medication. It seems to me that TerraPower is truly one of the few companies that is realizing the grand potential of the atom. And that's exciting. Until next time.